Hi, I'm Dr. Lawrence Schulman, Chief Medical Officer for ProHealth New York. Anytime there's an infectious process in our environment, we want to make sure that we're protected. Our job is to make sure that first, our patients are healthy, and second, our doctors and employees are healthy. Without healthy doctors and employees, we can't take care of our patients. This is a video regarding personal protective equipment, or PPE. We're going to show you how to wear it, dispose of it, and use it properly. We'll be joined in this video by a variety of medical specialists who will show us the proper technique for using our PPE. When we are safe, you are safe.
How to greet and room a patient. This patient has called ahead. She's explaining to the receptionist that she called ahead with reported symptoms of a fever and cough. The receptionist informs her that yes, we were expecting you, and hands her a surgical mask, which she asks her to put on. The receptionist then comes, opens the door, and escorts her back to the receiving room. The patient is now roomed and has been told that the doctor will be in shortly. The first step is removing our gloves. We want to do this in a way where we avoid contaminating ourselves. So the first glove is removed and dropped in the trash. The second glove is now removed by inserting your finger inside the glove and carefully removing the glove to avoid contaminating oneself. This glove is then also dropped in the trash. Avoid the temptation to pack down the trash. Now, clean your hands with an alcohol-based cleanser. This takes about 20 seconds, and you want to be careful to cover all surfaces of your hands. Once you have finished cleaning your hands, it is now time for you to potentially remove your surgical mask. You will reach and grab the straps, which are not contaminated, and you will now drop this mask into the biohazard waste. Again, as you've noticed, she avoided the temptation to grab the mask or pack down the trash. The last and final step will be putting on a single glove and cleaning the door handle with a bleach germicidal wipe. The germicidal wipe with bleach will then be used to clean the door. This wipe and the remaining glove will be dropped in the trash. And you have now successfully roomed your patient. At this point, the healthcare provider will enter the room. During this part of our video, we will be going through the steps for how a clinician or provider puts on their own personal protective equipment. The first thing we recommend is that if you are wearing an overcoat or any kind of overgarment, that you first remove this. You may hand that to one of your helpful colleagues or hang it up. If you have long sleeves, we recommend those be rolled up as well. The first step is putting on our gown. There are several types of gowns. Some of them are already connected in the top, behind the neck, and some of them require you to tie these. We recommend, if you are doing this solo, that you tie this before putting it over your head. Tie this any way you like, because this will later be torn. Once you have put the gown over your head, go ahead and put your arms through the sleeves. Now adjust the gown to make sure it protects your entire body, and finish by tying the waist tie. The second step is putting on your mask or respirator. For certain pathogens such as measles, tuberculosis, and SARS-CoV-2, the cause of COVID-19, the use of an N95 respirator is recommended. There are several different types of N95 respirators with several different looks. Assure that the N95 respirator is properly placed over your face and that the two straps are properly put on. The upper strap will be at the back of the head and the lower strap will be around the neck. Cup your two hands around your face, properly pushing the mask down about the bridge of the nose, and then breathe in and out, verifying that you have a proper fit. The next step will be putting on your goggles or face shield. These can either be integrated as we see here, or two separate devices. This will not only protect your face and eyes, but will also protect the N95 respirator if you are using one of those. The fourth and final step is putting on your gloves. The gloves should be put on in such a way that they extend to cover the wrists of the isolation gown. You are now ready to enter the room and take care of your patient. If there are any supplies that you will need, such as a flu swab or other diagnostic testing equipment, please bring those with you so that there is a minimal of entrance and egress during your interaction with the patient. After you are done examining the patient, you will then proceed to remove your personal protective equipment. We will go through the steps on how to do that, but realize you have finished seeing the patient. You now want to be 6 feet or 2 meters away from the patient, so as you remove your personal protective equipment, you are not in the potential contamination zone. During this part of the video, we'll be going through the steps for removing or doffing the personal protective equipment. We recommend that this is done in a dirty to clean manner. As you can imagine, your gloves are considered the dirtiest part. So we will start by removing one glove and dropping this into the biohazard waste. The second glove is removed by reaching inside the glove and carefully removing and dropping this into the biohazard as well. At this point, it is quite possible that you have contaminated your hands, even if you are very careful. We recommend using an alcohol-based cleaner to decontaminate your hands prior to moving on to the next step. This takes about 20 seconds to thoroughly cover and decontaminate your hands. The next step will be carefully removing your goggles or face shield, not your N95 yet. Remember, the outside the goggles or face shield is potentially contaminated, so you want to remove, reaching back and taking by the straps. You'll then drop your contaminated face shield and mask into the biohazard. Let it fall in and do not be tempted to pack down the waste. The third part is removing your gown. What you want to do is you want to reach behind so that your hands are inside and touching the clean part of the gown, and then removing it without contaminating yourself. Most of these gowns will tear away from the neck. It will take a little bit of force. Roll the gown with your hands, protecting yourself from getting contaminated, and then again, drop this into the waste. Avoid the temptation to pack down the waste. We do advise cleaning your hands again because you are about to grasp the door handle and exit the room. You will not remove your N95 mask until you are outside of the room and the door is closed. After leaving the room, it is important to carefully close the door behind you. It is now safe to remove your N95 respirator. First, we recommend again cleaning your hands, either with soap and water or an alcohol-based cleanser. This again takes about 20 seconds, so do a thorough and careful job. It is now time for you to remove your N95 mask. Again, remember, the front of the mask may be contaminated, so start with the lower strap, which should still be clean, and carefully raise this over your head, careful to avoid touching the front of the mask with your hands. You may now remove the second part, which is up near the top of your head. As you remove the N95 mask, turn it towards you and carefully inspect to see whether or not your mask has been contaminated. If your mask is clean and there is no signs of contamination, you may place this mask in a brown paper bag for reuse. We have learned since the H1N1 flu pandemic that carefully cared for N95 masks may be reused for extended periods of time. Should you have noticed that your N95 mask was soiled, contaminated, or wet, you would then need to throw this in a biohazard waste.
I'm Dr. Bonnie Simmons, Chair, ProHealth RMG, Urgent Care. I hope this educational video was informative. As part of Optum, ProHealth, and Riverside, our focus is on protecting the health and safety of our staff and ensuring that our patients get the best possible care. As with any public health issue, I encourage you to follow the guidance and protocols issued by the CDC, your state and local health department. Thank you, and please be safe.